Hey, how's it going? Ben here. I'm going to go over a basic yoga and calisthenics inspired routine to strengthen your low back and core. This could be for somebody that has injuries or is coming back to an exercise program or is new to calisthenics or yoga. It could serve as an introduction to either of those things, or if you were looking to start lifting weights or playing another sport, it can prepare you for that. If you're already doing those things but noticing back pain or core imbalances and you want to incorporate some body weight exercises or yoga, this could also be appropriate for you. This is assuming, of course, that you're cleared for exercise, that you don't have a very recent acute injury that prevents you from exercise. It's not meant to diagnose any conditions or give any medical advice, so make sure you check with your healthcare professionals. But if you are cleared for exercise and you just have ongoing or nagging low back pain, hopefully this could help you. This first video is just going to be a general orientation of the sort of mini program I'm going to have here, and some basic exercises that we'll call your daily hygiene. These won't be one of the workouts. This will just be something that I'm going to recommend you do daily or as close to daily as possible. Not particularly strenuous, maybe a little bit of a mobility demand, but we're not going to consider this a workout. The basic format will be two workouts. We'll call them workout A and workout B, and you're going to aim to do them 3 times a week alternating. So in the first week you'll do workout A twice and workout B once, and the second week workout B twice and workout A once, and so on. You can format that however you want: Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whatever feels appropriate for you. And it should take about 15 to 20 minutes and be moderately strenuous. They're not going to involve a lot of spinal flexion. It'll be mostly stabilizing at a neutral spine or moving into extension. So shortening the muscles of the low back. Particularly, we're looking to strengthen the musculature of the low back that runs directly along the spinal column and opposite of the low back, so the quadratus lumborum and the multifidus, your obliques, transverse abdominis. So everything that's going to stabilize your spine and hopefully allow those muscles to work properly and provide support for the spinal column. When you think about physics, it really can quickly add up to hundreds of pounds of pressure on your vertebrae. You might go, 10 or 15 or however many pounds overweight, or that's what I'd like to, maybe shed. That's the idea I have in my mind. But, if you're carrying something and then you have the weight of gravity compounding that, 9.8 kilograms per meter, acting down on your body, it can very quickly equal hundreds of pounds of force. And if your musculature around your spinal column is bound up or weak, that really is quite a lot of pressure that hopefully we can alleviate. Very minimal equipment for this exercise program. You don't even need these things necessarily. You can get started without them, but if you're going to give it a shot, go ahead and try and collect them over the next few days. It's a foam roller. This one I have here is on the longer side, and you can see it's ridged and pretty firm. I don't mind a firmer foam roller with a little bit of pressure. If you're not used to it, you might want to start with a softer foam one and then eventually move up to something like this. This here is a broom handle. It's a basic wooden dowel. You can take one off a broom. You can acquire one at Home Depot, however you want to do it. It's a wooden stick. And 2 small balls. These could be lacrosse balls. Again, those are going to be on the firmer side. Tennis balls will be a little bit softer. These are made specifically for this, called yoga tune-up balls. You don't need those necessarily, though. They do work well, but you can get, any sports ball. I'm just going to go ahead and turn this light on so maybe you all can see me a little bit better. Okay, so your basic hygiene daily, you're going to start with these balls, and I do want to phrase it that way. If we can start to change our attitude to look at this as just something we do, like brushing your teeth or showering, that'll go a long way, and you'll start to enjoy it hopefully as you feel better. So we're not even going to call this one a workout. You know, you wouldn't go days without brushing your teeth, so don't go days without taking care of your spine. If you miss a day every now and then, it's an odd thing. It's really not the end of the world, but get in the habit. So I'm going to lay on my back like so, with my feet flat on the floor. They're about a hand's distance away from my butt, and my back is flat. The first thing I'm going to do is start to tilt my pelvis just to find these two basic spinal positions. So throughout the rest of the program, when I refer to them, you'll know what I'm talking about. And also to just get in touch with the spine and the movement of the core. So I'm tilting my hips forward. If you imagine your pubic bone as a triangle with the top long line of the triangle on top and the point facing down, I would be tipping that top line away from my body. So that's an anterior pelvic tilt. That's bringing me into spinal extension. I now have space between my low back and the mat. And then tilting the pelvis back into the body, the posterior pelvic tilt is going to bring me into a slight spinal flexion. So my low back is now completely flat to the mat. And I'm just going to gently rock back and forth between those two positions, not going too far into the arch, just kind of rocking back and forth to be able to feel those two positions. And we'll call this flat, posteriorly tilted position a handful of different things. You might hear this referred to as spinal flexion, hollow position, neutral, although I'm not really at a true neutral now, I'm definitely in a slight flexion. So those are the key words to look for, or back flat, you know, any of those will indicate this position. And then here, you might consider this arched, open position, extension, back bend, any of those will refer to this position where the pelvis is tilting forward and the low back is arched. So the next thing I'll do is grab my two tune-up or tennis or lacrosse balls and lift my hips a little bit and place them on the tailbone, just one on each side. If yours kind of have a tendency to shoot out on you and go in every direction, you can put them in a sock to hold them together. And then again, I'm just rocking side to side with the two balls on my sacrum, noticing if there are any, you know, sort of tender positions. I feel pretty good. But if you come across a point where there's a lot of pressure, you know, you really feel it intensely, it's a tender spot, you want to stay there for about 30 seconds. I'm taking deep breaths through my nose. It's going to help me start to get in touch with my diaphragm and the muscles of the pelvic floor, which again are local stabilizers for the whole spinal column. I'm just rocking back and forth on the sacrum. The next section I'll shoot for is sort of where the lumbar spine meets the thoracic, so about maybe an inch below the low ribs, the lowest rib you can feel. In between the ribs and the navel on the back side of your body. You'll look for an indent there, and again, put each ball to either side of the spine and lay straight back. And notice now my legs are flat. They're no longer tucked with the feet flat on the floor. Now from here, again, I'll look for a spot that's tender, and I'm going to bring my hands up behind my head and come into a very slight sit-up position. Now notice I did start out saying that we wouldn't really be doing much spinal flexion. This is about the extent of it through the workouts. And this is more for purposes of the myofascial release and putting additional pressure into the balls. And you can use those two pelvic positions to increase how much pressure you have downward into the ball. So you want to feel a pretty firm press. And hold for about 30 seconds. Now I'm going to move the balls up to the region of the shoulder blades. And just lay straight back. Move around a little bit side to side to find a tender spot. And when you find one, again, lift head and chest very slightly. and move your body to bring weight into the balls. And hold there. And relax. Okay. So now we'll put the balls to the side and grab our foam roller. And the foam roller, where you focus on is going to depend on your own personal movement patterns or any imbalances that might be present. I'm going to hit on 3 main spots: the IT band, the lateral side of the thigh, the low and upper back, across the whole spinal column, and the front portion of the leg, the quadriceps. So this first one takes a little bit of a mobility demand. I'm going to have this outside arm planted flat on the floor and bring the foam roller up to the side of my hip with this back leg flat to the floor and the leg that's on the foam roller out long. I'll then start to use the foot that's planted flat on the floor, this foot here, to rock myself side to side along the foam roller. When I find a spot that's tender, I'll relax into it. And again, you can increase the pressure by the way you lean your body. And hold for about 30 seconds. Switch sides. And rock back and forth. Going a little bit faster than you might, just to show you these things. But once you get the hang, you can take your time. And relax. And then I'll put the foam roller at my tailbone and lay back and slowly move the legs in and out until I find a spot that, okay, right there, I feel that, I'll relax there. And then I'll slide the foam roller up to my upper back, and then here I'll walk myself in close to it and draw my arms up over my head. And then I'll relax my head to the floor, if I'm able to. Wiggle back and forth into the upper back and relax. Okay, that feels nice. You might want to do your quads if those are tight. The way to do that is to just lay out here on top of it and rock back and forth until you find a spot where you notice it's a little bit tender. And relax into the foam rollers. Okay, last part of the little daily mobility hygiene. You're going to grab your broomstick, your dowel, and bring it straight over your head. As in a wide grip, so my hands are the full width of the dowel. And then I will draw my arm straight back behind me as far as I can, feeling a stretch across the pectorals, the anterior side of the deltoid, that whole front body, and then retraction of the scapula. You might be able to touch the dowel all the way down to your tailbone and come back up. This is going to work with your thoracic mobility, your shoulder mobility. Good move for the posture. So I'm just going to start to fluidly move in and out. You might be at any of a variety of levels. You might only be able to come back, just level with your ears and hold there, or this might be no problem, in which case you'll shorten your grip a little bit. And try not to use a back bend to allow you further range in this motion. So, I'm not kicking my chest out and doing this to get back. I'm trying to keep a pretty even spine and draw behind me. There you go. So get in the habit of doing those 3 things almost daily, and that'll be a good foundation for the 2 workouts that we'll show you coming up here. We'll lay out the whole thing in the description, what the 2 workouts consist of and these 3 movements.